starts right now. President Obama wants to bring socialized medicine to America, but what lessons can we learn from other countries that currently have universal health care coverage? Now, recent headlines in places like Canada and Great Britain, well, I think they tell the whole story. Like this one from the Winnipeg Free Press. Man dies in Winnipeg ER after waiting 34 hours. Or this one from the Canadian Press. Doctors say that, quote, long wait times in ERs only the tip of the healthcare problems. And then there's this from the Irish Examiner. Dying patients must go on waiting lists for care. So will those headlines soon be splashed on the front pages of newspapers here in America? Joining us now is legendary talk show host, a pretty good guy, Phil Donahue. How are you? Good to see you. Thank you for being here.
Thank you.
First of all, before we even get into the specifics of this debate, Social Security is going to be bankrupt soon. Medicare is going to be bankrupt soon. Why do you have faith and confidence in the same government that can't even run the post office that they can run the healthcare system?
The only thing separating us from Canada is an imaginary line. You've just pointed out some anecdotal headlines. As many as 20,000 Americans die every year because they don't have health insurance.
According to who?
According to any survey. I'm happy to refer you to Public Citizen's Health Research Group, as fine and down the middle an agency as you'll find in Washington. They're doing the work on this. If you fall while you're skating on the Ottawa River on Christmas Eve,
I'm not going to be skating on the Ottawa River.
You're covered. Mm-hmm. You're covered because you're a Canadian. That's what we want.
Are we that's what you want.
And by the way, you know, they have the lines, Canada, the terrible lines. Ask a Canadian if he'd like to switch with us.
There's many Canadians, Phil, that flock to America because of the lines. Let me give you an example.
Who told you that?
You said in the head. Phil, let me just tell you. Recently, the Daily Mail in London talked about there's a government rationing body. You know what they determined in Great Britain? Socialized medicine. It determined that women with advanced breast cancer. My mom had breast cancer. My mom had a mastectomy. My mom had chemo. My mom had radiation. They determined that women with advanced breast cancer are not going to get the medicine that may save their lives because they can't afford it. And they've done the same thing with other forms of cancer. There's one horror story after another about long lines, inferior care, literally years for elective surgery for some people. Mm-hmm. Why would you want that here when we can't afford Social Security and Medicare?
Because the health care system we have is costing more and more every day. It's going to cost more tomorrow than it did today. And you're picking out isolated features of other...
They're all over the place.
We spend more money on health care per person in this country than any other nation on earth. And you're here telling me we can't afford to change.
But I'm saying
we can't afford not to change.
No, I think we can get better. I'm not saying
what we have, Sean, is not sustainable. You have to fix this. $1,500 a car.
You know what's
That's what GM has to pay.
You know what's unsustainable? What's unsustainable is the quadrupling of our deficit by Obama in 4 short months. The quadrupling of our debt. The CBO, gold standard, they say we're going to be paying $1 trillion on interest on the debt. They've examined his health care. For the 16 million people they say will now be covered. The $1 trillion Obama, that's the down payment. It's $62,500 per patient. Mm-hmm. Who's going to pay for that?
You would fix that by reducing taxes, probably, right?
Yeah, I would, actually. I would reduce spending, too, in Washington. I would reduce spending dramatically in Washington.
And one of the ways,
tighten their belts.
Yes. Well, one of the ways you can reduce the spending here in America is to go to the single-payer health care model. This means only the government pays the doctors. The government pays the hospital. There are no fees. Your taxes pay for the medical insurance that you get. Your health insurance is equal to every other citizen in the nation. You reduce the cost. And, doctors have increased threefold since 1960 or 70 in this country. In the healthcare industry, the agents who shuffle the papers have increased 30-fold.
Can I tell you
so
something?
we're paying billions of dollars every year to people who don't even deliver health care. They deliver forms, they deliver files, and they deliver the other things that we fill out when we sit in the doctor's office.
You're suggesting that I'm cherry-picking these articles, and I'm telling you they're all over the newspapers in Canada and Great Britain. Let me give you an example. Dr. Brian Day, this is what he said. These are his words in Canada, the single-payer system you advocate. Patients are languishing and suffering on wait lists. Our own Supreme Court of Canada has stated that patients are dying as they wait for care in Canada.
Yes,
is he lying?
I heard you when you read that headline the first time.
No, this is the doctor.
Well, am I lying? 20,000 people die in America because they're not covered.
Listen,
we can throw each other all kinds of numbers with lots of zeros, and we'll be here forever. Sean, what we have now is not sustainable. You can't continue this. This is a security risk. American automobile manufacturers can't compete with the rest of the world because of the cost of health care for their workers.
How did America survive all these years without Phil Donahue's single-payer system?
They survived just barely. And all these years, we didn't have Lipitor. We didn't have Coumadin. We didn't have, 30, 40 years ago, doctors had 7, 8 drugs in their little black bags. Today, and by the way, the pharmaceutical industry isn't doing very much, isn't doing poorly either.
And coming up, more of my interview with Phil Donahue, and a classic Reagan-era movie is returning to the big screen. Details on the major Hollywood remake that will have conservatives lined up